After years of pressure from medical groups, from LGBTQ plus groups, the FDA is out with a new proposal today to make it easier for men who have sex with men to donate blood. Under the current rules, the FDA restricts donations from men if they've had sex with another man in the past 3 months. Well, now the agency wants to let anybody donate blood, regardless of gender or sexual orientation, as long as they haven't engaged in certain sexual behaviors in the last 3 months. In other words, it means that most gay and bi men who are in a monogamous relationship will no longer need to abstain from sex to be able to donate blood. Joining us now from the White House is Dr. Dimitri Daskalakis. He is the director of the CDC Division of HIV Protection, also the deputy monkeypox coordinator for the Biden administration. Thank you very much for being with us this afternoon.
Thank you.
It is a significant and newsworthy change that is being proposed here by the FDA. Is it because of the new medical landscape here, what some see as a blood shortage? Is it because of evolving social norms, or is it a little bit of both?
The answer is it's really about advocacy and science that came together to really get to a place where blood donation policy can be dictated by science as opposed to antiquated strategies that were discriminatory. So the answer, in short, is it's a little bit of both.
Can you help us understand why it seems, and help us understand this, right? Why do gay men have to be abstinent for 3 months or in a monogamous relationship to donate blood, but it doesn't seem like there is that same requirement for heterosexual people?
So that's actually the crux of the problem. So looking at this sort of historically, early on during the the dawn of HIV/AIDS in the United States, there was concern about the safety of the blood supply. And really, technology hadn't come to the point where blood was screened in a way that would really ensure safety. So as we've moved forward with more technology and also great ability to forecast how we can predict risk based on behavior rather than identity, we are here today with proposed guidance that really changes the game in terms of who can donate blood.
You know, as part of this policy, the FDA says that anybody who's on medication like PrEP that treats or prevents HIV, they are not eligible to give blood. You know what people on PrEP have to go through. Is it better for somebody who is HIV negative to be on PrEP and not give blood, or to not be on PrEP and be eligible?
So I think ultimately people make decisions about whether to be on PrEP around sort of what is best for their health. That's independent of the sort of altruistic moment of donating blood. So people who need to be on PrEP or who want to be on PrEP should maintain that PrEP rather than sort of change that plan based on the desire to donate blood. So I'll start with that. But I'll also say that I think ultimately the signal from the FDA here is that they're really looking at the science and engaging with advocates in the community in a way that tells us that as the science changes, this is not a policy that's static. There is interest in making sure that it's modernized and reflects the cutting edge science that we have.
You talk about the evolution. You talk about this being sort of a living, breathing decision-making process here. But I wonder what you would say to critics who might argue that this actually is discriminatory against gay men, frankly, because of some of those requirements that are in place.
Yeah. So I'll start by saying it's a really important milestone that this is moving forward. It's really syncing with many other countries that have moved in the same direction, specifically to remove the element of what is discriminatory. So asking the question, are you a gay man, and then saying you can't donate blood or you have special discriminatory factors around why you can't, that really is potentially taken away with this draft guidance. I think it's really important that people know that public comment is open for 60 days, and I think there's a track record here of the FDA listening to what that public comment looks like. But ultimately, this is a move that is so in sync with so many other nations, specifically to address the issue of this is not about who you are, it's about what you've done in the last 3 months, and if that is associated potentially with some risk for HIV infection. So it is a step in the direction to really address the discrimination, and I think is really in line with what's happening internationally.
You call it a step forward. Do you think the FDA could do even more to ease these regulations, and is that something you'd support?
Yeah. No, I think that it's really important that there's commitment to follow the science. So I think as the science dictates, I think that the FDA, though I can't speak for them directly, are keen on making sure that they connect with the community and connect with the science. So the cutting edge is where we are in terms of blood donation policy. I'll just echo again, this is in line with the UK, with Canada, and other countries that have gone through this process of looking at what is the best strategy to address the discrimination that needs to end while also maintaining a safe blood supply. So again, I think that always remembering that it is always an interaction between advocates, the community, and science in terms of how these policies look. I think that as the science changes, as we learn more, the FDA has been a really willing participant in those discussions.
Dr. Dimitri Daskalakis, thank you very much. It's good to see you back on the show. I know you have a tight schedule. I'll let you go.
Great.
Appreciate it.